Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 2. It's the second week of your 40-week pregnancy journey. Just like week 1, you still aren't technically pregnant, but you're closer than ever to that goal. During week 2, your body is getting ready to ovulate to maximize your chances of creating a new life. Now is the time to pay attention to your body's subtle fertility signals and spend some quality intimate time with your partner. Remember, your healthcare provider calculates your due date and the 40-week countdown from the first day of your last period. So, if you had a positive pregnancy test and think you have been pregnant for 2 weeks, then you are actually at week 4. While there is no fetal development at this time, it's coming, and your body is preparing for it. In your ovary, an egg is maturing and getting ready to break free. Meanwhile, the lining of your uterus is growing and getting thicker to accept and nourish a new life. At the end of the week, ovulation will occur as your ovary releases the egg into your fallopian tubes. An egg can survive for 12 to 24 hours after ovulation, but you don't have to have sex on the exact day of ovulation. Since sperm can live up to 5 days in fertile cervical mucus, you can have intercourse every other day during week 2, or time intercourse a day or 2 before ovulation, to get the sperm in place, ready, and waiting for the egg when it's released. Of the millions of sperm that start the journey to the egg, only a fraction of the healthiest and strongest will make it to the fallopian tube. Once there, only one will enter the egg. When the sperm and egg join together, it's called fertilization. Week 2 pregnant symptoms. With your period over, you may be feeling pretty good this week. You may not have any symptoms at all, or you may notice a few changes in your body. Week 2 symptoms are not pregnancy related, but they may be signs of ovulation. Getting pregnant relies on timing sex for when you're most fertile. This is probably in the 2 days before you ovulate and the day you actually ovulate. If you've got a regular 28-day cycle, chances are you ovulate around day 15. At 2 weeks pregnant, ovulation symptoms can clue you in on the best time to have sex and hopefully conceive a baby. You're probably ovulating if you notice these signs at week 2 of pregnancy. Egg white cervical mucus. Sounds a little gross, but it's true. Your cervical mucus becomes thin, clear and stringy, like egg whites, as you near ovulation. This consistency helps sperm travel toward the egg. Better sense of smell. Believe it, hormonal changes boost your ability to pick up different scents, which is probably nature's way of helping you sniff out male pheromones in an effort to procreate. Breast soreness or tenderness. Hormone surges associated with ovulation can make your boobs feel slightly sore. Pelvic ache. As your ovary releases an egg, you might feel a little twinge in one side of your abdomen. This is the phenomenon known as Mittelschmerz, named for the doctor who first documented it. Light spotting. You might notice a small tinge of red or brown on your underwear around the time of ovulation. This spotting can be common, but let your doctor know if you experience something heavier than just random spotting in between periods, or if that spotting is bothersome to you. Increased sex drive. You might just know that you're ovulating and naturally get revved up for some baby-making sex. Cervical changes. If you check your cervix routinely, you may notice it becomes higher, softer, and more open when you're ovulating. Some women buy an ovulation prediction kit to help them figure out when they might be most fertile. Or, you can just have sex every other day from about day 10 to day 18 of your menstrual cycle, meaning toward the end of the 2nd week to the beginning of the 3rd. Self-care tips. Trying to conceive can be exciting, but it can also get stressful, especially if it's been a few months. Be sure to care for your physical and mental health this week. Care for yourself. Eating well, engaging in regular exercise, and getting enough sleep can help you feel good and fight off stress. It can also put you on the right path to maintain a healthy weight for your upcoming pregnancy. Take your vitamins. Start or continue taking folic acid or a prenatal vitamin to get all the nutrients you need to stay healthy during pregnancy and help prevent health issues for you and your child-to-be. Try to reduce stress. Typical everyday stress isn't likely to interfere with getting or staying pregnant, but high levels of stress and the pressure of trying to conceive may negatively affect fertility. You can try to keep stress under control by practicing relaxation techniques, meditating, taking a walk, or spending time with friends. If you find yourself overly stressed or anxious, you can talk to your doctor or a mental health specialist. Your Week 2 checklist. Pay attention to your body and look for signs of increased fertility. If you're unsure when you will be ovulating, consider using a home ovulation test. Engage in sexual activity as you approach mid-cycle. Notice fertile cervical mucus and feel an increase in your sex drive. Continue taking folic acid or prenatal vitamins. Seek out ways to keep stress and anxiety under control. Thank you for watching. Don't forget to subscribe